So, Doctor, I think maybe an ultimate question we all have, that's for ourselves, for our families, but also for corporate leadership, for investors, is how bad could it get? We had Bill Gates write in the New England Journal of Medicine that he thinks we should take seriously the possible. This is along the lines of the Spanish flu, and he gave it two reasons. One is what he called the efficiency of the disease, that one person can give it to two or three other people, and the other is the lethality, not just for some of the people who are compromised, like you said, but some healthy people. Is he right?
I don't want to say he's right or wrong per se, but I think the worst case scenario is the Spanish flu. That's certainly sort of the upper limits of what we might see with this. I think one good thing is we haven't seen younger people affected by this in the same way that we did with the Spanish flu. I mean, really, the largest burden has been in people over the age of 50, and especially people over the age of 70. And as I mentioned earlier, people with chronic medical conditions who could be younger, and healthcare workers. And healthcare workers are potentially at risk for being exposed not once, but many times and in much larger doses. You know, if you remember Dr. Li, the ophthalmologist in China, well, think about when somebody examines your eye with what we call an ophthalmoscope, that special scope with a light that they use to look into your eyes. They're literally face to face with you. So that those are just very different exposures than the average person is likely to have.
Just really quickly, a point of clarification. When you say it could be akin to the Spanish flu, are you talking about the notional numbers? Because there was about 50 million, but the world's population was much smaller at that time. Or are you talking about proportionately? Larry Summers, who's a contributor on this program, put out a statement, an article yesterday in the Washington Post, where he thought that the upper bounds would probably be sort of worst case scenario around the 7 million mortality rate. I'm not saying that that's better or worse, but I'm just trying to understand what your reference point is in terms of that comment about Spanish flu.
Yeah, I'm referring to the case fatality rate. So right. upper limits of 2%. I think most likely we're probably looking at more in the 0.6 to 0.8% range, at least as would be applicable to us, at least based on the data that we're seeing out of countries like Singapore and so on, that are with health systems that are more similar to ours. So I think, you know, part of the problem right now is not every country's healthcare system is comparable. And so what you see in terms of statistics coming out of China is not necessarily exactly what you're going to see here.